My name is Dr. Ruchit Nagar. I'm the CEO of Khushi Baby. Our solution is climate health vulnerability mapping. Our story starts in Rajasthan, India. Devi is an ASHA or community health worker. Today she's going to visit 10 houses in her village to track maternal and child health, non-communicable disease, and vector-borne disease. She works in Rajasthan, which is India's largest state, home to 80 million people, two-thirds of whom are living in rural areas. Rajasthan also has 90% of its districts in drought-prone areas, a growing burden of heat-related illness, the country's largest burden of lung-related disease, the most polluted city, and growing vector-borne disease as well. How is Devi supposed to address these challenges as Rajasthan is increasingly prone to climate-related changes? We know that climate affects health through a variety of mechanisms: poverty, nutrition, and displacement. How can we turn climate-related spatial predictors into real local health insights? It requires taking climate-related datasets available globally and publicly, and combining that with local intelligence from these communities collected by these community health workers on things like social determinants of health, as well as longitudinal health information. That will allow us to track multiple health outcomes that are climate prone, such as malnutrition, lung disease, water and vector-borne disease, and heat-related illness, as well as zoonotic events. Our goal is to digitally empower 1.3 million community health workers so that way we can have this climate health preparedness that we need. We're already on our way with CHIP, the Community Health Integrated Platform. We have a unified offline mobile health interface that tracks all primary healthcare programs longitudinally and facilitates care coordination amongst ASHAs, nurses, and doctors. We've developed this with over 200,000 hours of co-creation in the field, and now 70,000 community health workers have tracked 40 million beneficiaries, identifying 4 million high-risk beneficiaries with this platform. This now allows us to actually unlock health insights by mapping the burden of disease, interpolating missing areas, identifying spatial outliers, and relating influential variables from climate and community on health outcomes, and using this information to target interventions and measure their impact. We've used our geospatial platform to develop India's first village-level, statewide multidimensional poverty index with individual analysis of why that poverty has come about in each village. We've correlated child wasting across the state with ultraviolet index exposure, and we've done spatial temporal analysis between vegetation index and the burden of mosquito-borne disease and insecticide treatment. Our 65-member interdisciplinary team between public health, data science, and policy, our world-class partners with government, research, and implementation